South Korea may see more than 3,000 new cases on Wednesday. That would be the second highest figure since the start of the pandemic here in the country. Also on Wednesday, health authorities will announce emergency plans and changes to the booster shot campaign in a bid to try and address the climb in infections as well as those people who are critically ill.
Now, to fill us in with more COVID-19 related updates, we have a reporter Yeon-seung in the studio. Good morning, Yeon-seung.
Good morning.
So let's start with the infection numbers for today. Can you tell us more on that?
Well, unfortunately, South Korea saw quite the jump last night, almost 1,000 cases up from Monday night. So up until 9 p.m. Tuesday, authorities tracked more than 2,800 new COVID-19 infections. This is actually the highest late-night tally reported since September. There's a high chance that Wednesday's morning official caseload will rise above 3,000, the second time that the official tally has hit that 3,000 mark since the onset of the pandemic. Infections in the Seoul capital region made up almost 85% of the cases recorded on Tuesday night, with Seoul City's cases marking a new record high, 1,380 infections in less than 24 hours.
Yeah, I seem to remember us reporting that we weren't going to talk about the total number of cases anymore, but that seems to have gone completely out of the window. But in regards to the capital, that's where the real concentration of cases is, as you would imagine, since it's the most densely populated place in the entire country, Seoul and its surrounding areas. But there is an issue with ICU beds and the supply of those, because you need very special equipment to treat people who are seriously ill with COVID-19. In terms of the number of people who are critically ill, what can you tell us about that?
Well, I'm glad you mentioned the critically ill cases because they're also an impending problem. Health authorities had mentioned earlier that one of the warning signs showing that the country is moving into a dangerous level is if there were more than 500 critical cases per day, and it seems like the country is edging in closer to that point. On Tuesday, 495 patients were reported to be in critical condition, which is also a new record. Authorities are devising an emergency plan to address the steps they will take if the current situation escalates. This plan will be announced this afternoon. They've actually rescheduled this announcement a few times now, but in the event that they don't shift the dates again, I'll be able to give an update on the full plan during tomorrow morning's newscast, so stay tuned.
Well, alongside that plan, I heard that there's going to be another announcement today, right?
Yes, you're absolutely right. Health authorities are also making changes to the booster shot campaign. So they will actually shorten the interval between the primary and the booster vaccine doses. They're hoping to tackle the growing number of severe infections among the elderly and those with fading immunity.
While there are only 8% of people in their 60s and over who are not fully vaccinated, they made up 61.7% of the total 452 deaths from October 3rd to November 6th.
So in other words, unvaccinated people in higher age groups only make up around 3% of the country's population, but more than 60% of the COVID-19 related deaths. Currently, the booster shot campaign recommends most recipients get their top-up shot 6 months after being fully vaccinated. But the new plan will most likely recommend people in their 60s and over get their extra jab at least 4 months later, and people in their 50s to get theirs at least 5 months after full inoculation.
Okay, so you've given us a comprehensive overview of what the situation is like in South Korea, but let's broaden our scope to talk about what's going on in the world in regards to this pandemic, and especially in regards to treatment for COVID-19. What's happening there?
Well, I want to talk about one of the game-changing pills named paxlovid. Pfizer has signed a deal that will allow generic versions of their COVID-19 oral pills named paxlovid to be licensed to 95 low to middle income countries. Although the drug has not yet been distributed to the public, it has shown promising results in clinical trials and is seen as potential game changers. The company is hoping that this drug will play a critical role in quelling the pandemic and saving lives in those lower income countries where more than half of the world's population live. The drug is expected to be priced at around $700 but in lower income countries, that price tag will most likely be brought down. Pfizer's move, however, has been met with some criticism that some of the hardest hit countries, like Russia, Turkey, and Brazil, are not included in this deal.
All right, Yeon-seung, thank you for that report. We hope to talk to you again tomorrow with more updates.